The process for getting a prosthetic limb at Bionic Innovations involves multiple steps. We are not going to cut any corners when it comes to designing the interfaces. We try to be upfront with people in the very beginning, the amount of time that it's going to take, and the reason that each one of those visits is important, because we gain information from each visit that expands upon each other. So the process would be initial consultation, discussing patients' needs, wants, desires, what their activity level was, the things that they want to get back to doing, and in doing a physical evaluation of their limb, their body, and things of that nature. And then once we get started on the prosthetic limb, we take a 3D scan of their residual limb over top of an interface material like a gel liner that they might wear to help protect their skin. And in addition to the 3D scan, we'll take measurements to compare against the scan. That gives us the information that we need to create the actual socket interface and the shape that they're going to actually be wearing on the limb. We'll then go back into a CAD program and design the actual interface shape that they're going to be wearing. We'll give that 3 dimensions and 3D print a diagnostic socket that is clear, such as this, so that when somebody is wearing it on their limb, we can see, do we have high pressure points? Do we have areas where we have voids that we need to make changes? So those diagnostic fittings are very important and are areas where, others in the field are trying to get away from diagnostic fittings. We feel that the value of diagnostic fittings is highly important to the end product. And that is one of the most important steps of the entire process. So we'll do not only one, sometimes 2 diagnostic fittings if we need to. And then once we make sure that the shape is perfect for that patient, then we will bring them in. We'll make sure that they are using that diagnostic socket. We'll bond it to a foot or a knee or both, depending on the amputation level, have them walk on it. Make sure that the alignment of the foot and the knee are appropriate for somebody's needs and their weight line and their body position prior to that final fabrication. And then what we will do is preserve that alignment so that when we fabricate the socket, that we make sure that when they come back in for their final delivery, that the components and the fit are perfect and that they've already experienced that prior to taking the prosthesis for a final delivery.